sitting down to have a chat about my wisdom teeth that I had removed, I think about 2 months ago. I've still got some scarring that is healing on them, but I'm feeling in a spot now where I've learned a lot, and I want to share it for anyone who's getting wisdom teeth removed. Some things I wish I had known, whether people had told me, whether that's a doctor or my friends, or I just was able to find the information to give me a little bit more preparation into getting my teeth removed. So I had 4 wisdom teeth, 3 had come through and 1 was still sitting up here somewhere, let's say. I was having problems with this one here. Food was getting stuck in it. These ones were pushing in, and on my bottom teeth were like really badly starting to move, and I was starting to get problems with them. Went to a dentist and she didn't want to touch me. She's like, no, you have just got, there's a lot going on, you need to go see a specialist. Went to the specialist and he's like, look, you're a great candidate to get them taken out. I'm under the age of 40, I'm fit, I'm healthy, I've got no other dental history that's got major problems with me, but you have to go, like, it's surgery, you're going to go under, I can't do it any other way. So I was like, okay, great, let's get them taken out. So a bit of background, I have never had anything done to my teeth, any issues with my teeth. I've never had braces. I've got 4 fillings, I think, and 2 of those were due to every time I have fallen pregnant. I've had a tooth and it's basically just corroded away, and I'm putting it down to pregnancy because I'm pretty good with my teeth. So that's it. I've never had to go to a dentist for issues. So because of that, I have never had x-rays, I have never had scans done of my mouth, and I never knew how complex my wisdom teeth were. If I had known how complex they were, I actually probably would have had them out at a younger age. The younger you are, the quicker the recovery, so I am told. The older you get, your wisdom teeth start fusing and become more of a harder bone. And that's what my specialist is saying, over the age of 40, it can be a lot more complex to get your wisdom teeth taken out. This wisdom tooth had not come down yet. These 2 here were actually going this way. They weren't pushing my teeth, they were actually going into my bone. I had to get some special scans done. It wasn't just like an x-ray or an ultrasound. I had to get this really weird modeling done of my teeth because they were concerned with some of my nerves. So they got that done, and yes, it was a bit more complex than a standard wisdom tooth removal. So some of the feedback or tips I'm going to share, I was probably a bit more on the extreme scale. It wasn't just a we put you under, we take the teeth out and you're good to go. I did get some complexities with mine. I'll run you through really quickly, and then I'm going to give you tips on things that I wish I'd known beforehand, especially as a mum. It would have made my first week, because my first week was hell. To get your wisdom teeth taken out, the doctors told me, my specialist said, look, it can be between 45 minutes and an hour and a half for the surgery that usually takes place to get all 4 taken out. Mine was 4 hours to get my wisdom teeth removed. I ended up getting jawbone cut out. This tooth here, the roots, my dentist said I had deep-rooted wisdom teeth, and the root on this one here actually ended up coming up all the way into my sinus cavity. I ended up getting a sinus infection. These 2 here, the roots actually ended up coming all the way down here. So they had to cut my mouth open to be able to get them out due to the nerves. So there is a risk of some percentage that when you get your wisdom teeth taken out, apparently there's a nerve that can affect your lip here, and it can make it go numb. It didn't end up affecting me, but I think it's more of a delicate operation. So I actually had scarring and stitches. I'm just trying to feel what it is. It stops there inside my mouth. This side here sits a bit further back, probably around there. So that was quite extensive. I have actually got, it's hard to explain, but say that is where, so let's just say that is your jawbone sitting inside your mouth there. I've actually got like big sections chipped away, and I can feel it because the gums have healed, and I've got like these, not holes, but like these caves inside my mouth where the gum has healed like that, and that's where my jawbone is, and then it's cut away to go down. So mine was very, very complex. I was in a lot of pain. I'm not gonna lie, I was in a lot of mouth pain. I came out of surgery and I was in a lot of pain. They gave me extra medications for it. I didn't expect the pain to be that bad and for that long. So that is my surgery journey. It was not a quick one. The surgeon did come out and he gave me the thumbs up to say, look, he's really happy with how it went. We touched base in a few weeks to look at the recovery, and from there, things I wish I had known. So when I had gotten out of surgery, they said to me, I cannot use a straw and I cannot have fizzy drinks of any kind. Other people in the recovery room, they were fine. They were sitting up having, one girl was having like a Coke, someone else was having a cup of tea. I was told no hot drinks, no straws, and no fizzy drink. I don't remember the exact reason, but it had to do with where my stitches were, the increased risk of a blood clot happening up in the back area, and pressure or something along those lines. So I couldn't use a straw and I couldn't have soft drink, which kind of would have been handy to have known, because I was just like, when I get home I can just have lots of lemonade. When I'm sick I like to drink Lucozade. I couldn't have it. So that would have been nice to have given the pre-warning that that was a possibility. So don't come out of surgery thinking you can have a straw or soft drink, because I was told I couldn't. Chances are you can, or you might be able to. I made that assumption and I was told no. When I got out of surgery, they told me to buy a children's toothbrush, and because it burns, just a gentle mouthwash where I could swig around and clean my teeth and spit out. I'm just gonna be honest with you, I could feel every single stitch in my mouth with my gums and my tongue. I could feel it, and it wasn't really a nice feeling. So to be able to like wash my mouth and give it a bit of a clean was really good. And they said why to get a children's toothbrush. Obviously the head's not as like thick or as deep, so you can fit it into your mouth a bit easier. I think because my mouth was pulled open for so long, and I was so swollen. I'm going to put some photos up throughout the video so you can see. This is not to scare, this is just to show you what I went through. I look back now and I laugh, but I think it was like on day 3, I was crying to my husband saying, just go put them back in. It was real. I struggled. I know there's worse, but I was in a bad place. Day 3 or day 5. So yeah, I could not open my mouth to get like, I couldn't go that high. I could not open my mouth. So when it came to eating things, I literally had a spoon sitting there and went, and I let the food slide into my mouth. I batch cooked a bunch of pumpkin soup. I batch cooked, I bought tins of veggie soup and minestrone soup. I couldn't eat it. I could not get hot food in my mouth. It caused excruciating pain because I was so swollen. My gorgeous girlfriend, who did not know this at the time, I don't think she knows it till now, so thank you. She the next day when I was at home, I think it was. Yeah, it was the next day at home. My husband took the kids out. So surgery happened on a Friday. Highly recommend getting the surgery done on a Friday because you've at least got the Saturday and Sunday to be complete write-off, which I was. Saturday, my husband took the kids out for the morning to a park and had a play, and I just laid on the couch full of drugs, medicine. I had an Uber Eats delivery and she ordered me ice cream. I literally think she saved me that day because I could not eat anything. I was sipping down water. I think I was sipping on orange juice. Or was that too acidic? I can't remember. And an Uber Eats delivery came with ice cream, and I literally sat there on the couch, almost in tears, slowly letting it fall off the spoon into my mouth for me to eat. So when you go in for surgery, I'd be prepping jelly, I'd be prepping or having cold custard available, I'd be prepping and be prepared to have ice cream. I didn't want to have sweet foods. I don't have a great sweet tooth, I'm more savory. I had no choice. I had to eat what I could literally suck down into my mouth. I was hungry. I was extremely hungry for about 5 days, purely for the fact I could not open my mouth. I could not get hot food into my mouth. I could not chew, and I struggled. The medication I was on actually ended up making me really sick, so they had to change the dosages a little bit. So by day 5, I think we had things under control. My swelling, I think, was at the worst on day 5, and this side here, I think this side here was the worst. I actually popped out quite badly on the side down the bottom. So I think it got to day 5 before I could actually start to do anything. And by then I was trying to suck down soup. I think I had 2-minute noodles and I was trying to like sip the noodle in, and I'd like squash it with my tongue to the roof of my mouth to try and eat. I was hungry, so hungry. And if you watch other YouTube videos or you'll Google it, you will see that people that have probably more extensive surgery to get them removed, their biggest complaint is that they are so hungry. The second thing is, after surgery, I had one of those tie up ice bags, and the nurse was great. She's like, you need 2 of these. So she gave me a spare one, and she said, while you're wearing one of them, the other one's in the freezer and you can just rotate them through. Don't take the ice bag off. Leave it on. I think I slept with mine on for the first few days and nights, and that leads me to the next thing. I could not sleep laying down for a full week. Now, I had mine all out at once. If I hadn't had it done all at once, I would not be going back to get the other side done. I'm just being honest, because it was so painful, and I know what I went through. I would just be like, I'll just suck up and have one good side of my mouth to eat and one not so good side of my mouth to eat. But because I had both done, I could not lay down. If I tilted my head like this, the pressure on all of my stitches, it would just cause so much pain. So I had to sleep sitting up. So what I done in my bed is I would sit up, and we've got quite long pillows. I put one here and like wedged it into me, one here and wedged it into me. So if I fell asleep, I'd kind of like tilt my head into the pillow, or tilt my head into that pillow there. I think I slept more on the couch throughout the day than I did probably sleeping in the bed. This is the next thing that I wish someone had told me. I was told 2 to 3 days I'd be out of action, and my husband and I were like, that's great. He'll work from home on Monday if needed. I've got the weekend, and then, you know, I'll just walk around with a swollen face. No, I was a complete write-off for about a week. I pulled myself together on Tuesday and I said to my husband, go to work. I should be fine today. I should be fine. Go to work. I dragged myself out of bed. I took my kids to swimming lessons. I dragged myself home. I crawled on the couch and I could not move for the rest of the day. My kids just played around me. Thank goodness I had like crackers in the pantry. I messaged my husband and I said, you have to come home. I can't do this. And he had to work from home, take days off because I was that bad. So it's done. It is what it is. I just wish we had been preempted on worst case scenario, because my husband would just have taken the week off work. He would have taken the week off work. I probably would have had more time to rest. My kids probably would have been more occupied, because I could not move. I was in so much pain. In saying that, come day probably 5, 6, maybe it was day 6 or 7, I can't remember exactly now, I was definitely starting to feel better. I was starting to eat food, and by eat food I was still slithering it down my throat and squashing it on the roof of my mouth, and I was eating more food. I was sleeping a little bit better, so I was able to probably lean back a bit and sleep instead of having to sit up. So just to lay back to sleep, I'd have like against our headboard 2 pillows, then 1 pillow, so it created like a triangle, and I would lay on it, and then I'd have a pillow still either side of me. So if I tilted my head too far, the pain was just excruciating. I think it was day 9 I started feeling the stitches falling out. They were self-dissolving stitches and they were falling out. So everything was doing its job. Recovery is really good. I'm glad I got it done. I don't want this video to scare anyone by any means. It's just, again, if someone had said to me, go buy non-alcoholic mouthwash, I would have had it here. If someone had said to me, the surgery can actually be more complex, they don't know until they cut you open, allow for worst case scenario, I would have. If someone had said to me, there is a chance you cannot have a straw, you cannot have fizzy drink, you will not want hot food, I definitely would have planned some food prep differently. I would have pureed up peaches and apricots, and I would have bought tins of baby apple food just so I could get things into my stomach. I didn't have that stuff. My husband went back to work on Tuesday, and when you're on medication, you're not thinking properly. So if I was to go back and do it again, I'd be buying tin fruit, pureeing it up, so when I get out I could sip it down and at least get things into me. I'd be buying cold custard, I would have jelly, probably like watered down a bit more so I could easily slop it down. I definitely would have planned it a lot different. I would have asked my husband to take the week off work. I would have had my mum come over and help, or any sort of family member come over and help a bit more. I would have been a bit more mentally ready for what was going to come. The swelling didn't bother me. I knew there'd be sleepless nights. I think for me it was the extent, like how long. On like day 3 I should be feeling good now, and I was feeling almost worse. Day 1, so I got out of surgery, I think it was 6:30. I went in at 1. So after they do like your pre-admissions and all that kind of stuff, husband was there at 6:30 to pick me up. I think I was in recovery for like 30 minutes. I have never been under anesthetic before, and coming out of anesthetic I was very, very sick. The girl beside me, I don't know what she had done. It was obviously some sort of dental procedure, but she was sitting up straight away. She felt good. She could sit in the recovery chair. I really struggled to sit up. I wanted to throw up. They had to get 2 nurses to kind of lean me forward and ease me into it. So I've never gone under before, so that was a very new experience for me. I know for next time, and I'll flag it with them before I go under next time, that that's how I come out of recovery. So looking back, I'm glad I got it done. They're all out. I have never had major dental work. I have never gone under before, but there are definitely things I just wish I had known were a possibility. I think we were just being told it should be this, and we just thought best case scenario. Maybe I should have asked more questions when I was going in to get it done. I don't know, but again, you never know until you really cut someone open and have a look. So I just thought I'd share the journey. So if you're about to have your wisdom tooth or teeth taken out, look, I look back now and think, yes, I'm so glad I had it done. But just prepare yourself. And hopefully the tips I have shared in today's video help you to some point. If you have seen my videos go up, if you watched me on my Instagram channel, on my Instagram page while I was in recovery, look, I can look back and laugh now. I hope you see my photos that I posted in today's video and get a bit of a giggle out of it. I didn't come out of my anesthetic a giggly or gassy or happy. I was the complete opposite. I wish my children were older and I could have asked them what their reactions were of me that week that I was in recovery. Probably wasn't great for them, but that's it for today's videos, guys. I hope it helps someone who is about to go through their wisdom teeth removal. I did watch a few videos on YouTube, but I found them just to be almost not comical, but just the procedure, and there was no I wish I had learned or don't forget this here. So I wanted to make mine a bit more informative. I hope you enjoyed it, and we'll talk soon. Bye.